in high definition. This is KCAL 9 News.
Millions of people trying to get in shape with the new year, and that might be a good time to see that your teeth and your mouth is in shape as well.
Yeah, don't always think about that, but a healthy mouth can help your overall health. Dr. Arthur Glossman is here to show us his 4-step approach to a better smile. Dr. Glossman, welcome.
Thank you.
We were just talking about if you're brushing, that's not enough if you're just brushing your teeth.
It's not enough anymore. You have to brush before and after meals, before bedtime, in the morning, and after you eat foods that could stain your teeth. That's really important. And always brush with a toothpaste that has fluoride in it. The next thing you want to do is floss. Make sure that you floss so you can take out the food and debris that's caught between the teeth, which is where most dental decay usually happens, and inflammation of the gums.
Now, you said brushing, and you named a couple times when we should brush. I thought the recommended was twice a day. Not good enough, huh?
Not good enough anymore. Best times are after meals, after you have foods that stain your teeth. And those are the times that are really important, especially before you go to sleep, because when you're going to sleep, you don't brush for the next 6 to 8 hours, and in the morning, you build up a lot of plaque and bacteria.
What kind of foods can stain our teeth? Which would be looking out for?
Foods like coffees, teas, red wines, tomato sauces, those type of foods and drinks stain your teeth.
Pretty much what you might think,
yes.
Like blueberries and stuff.
Blueberries,
like
lots of berries. Also not good to use after teeth whitening procedures as well.
All right, so now that we've done a good job brushing, what do you recommend for flossing?
Flossing, either waxed or unwaxed floss is good, depending on what's preferable for you. But flossing after you brush helps dislodge a lot of the food particles that get left behind. Studies have shown that brushing alone only cleans 25% of your teeth, so flossing is really, really important.
And is that a once-a-day thing, or?
Flossing is great after meals. That's generally what's recommended, and that helps the whole process of cleaning your mouth. In addition, I also recommend mouthwashes. Mouthwashes are really important. It helps dislodge the food and really give yourself good breath, especially after you eat certain foods.
So if I just brush and that's the only thing I do, you say I'm only getting 25%.
You're only getting 25%.
And does flossing fill out the other 75, or are there other things?
Flossing
rinsing?
And rinsing with mouthwashes pretty much gets the entire mouth, because fluids can get into crevices that obviously the bristles of the toothbrush can't get into. So it's really more of a 4-step approach where you have to brush, floss, mouthwash, and develop a healthy lifestyle, meaning good diet, managing your stress, seeing a dentist, and overall, getting good exercise within your day.
Yeah.
Let's talk about how your mouth does relate to your health, because we're now learning that dentists can be on the first line of defense to some pretty intimidating diseases. We're talking about things like cancer and things like that you can pick up in the mouth. What are you looking for?
We're looking for signs of inflammation. When there's inflammation on the tissue causing periodontal disease, inflammation on the tongue, on the roof of the mouth, floor of the mouth, those could be signs of greater inflammation that's happening within the body, because our mouth really is the gateway to the body, and a lot of things that we can detect, we can then pass along to the patients and have them see their regular doctor. So we could pick up a lot of infections and diseases that way.
How is that related? What you would think that if there's something going on somewhere else in your body, that's pretty much confined to that area. How is it transferred to your mouth?
Well, if we see signs of periodontal disease, for example, inflammation of the bones, ligaments, and bone structure supporting the teeth, that type of inflammation can then cause bacteria to infect the arterial walls of the heart.
Oh, I see.
Therefore causing damage to heart vessels, and then causing different type of plaques to accumulate, block arteries, and cause cardiovascular disease.
Yeah.
When you're talking about inflammation of the mouth and you detect it, is this something that a patient would not necessarily feel or detect on their own?
Sometimes not, because it doesn't really hurt. And unfortunately, we don't feel a lot of the pain until it's too late. By the time patients feel it, and they haven't been to the dentist, it's already too late and the infections have spread. So, it's really important to see the dentist at least twice a year. If you can do it more often, it's in your benefit, because good oral health really correlates to general overall well-being of your body.
Makes sense. Dr. Glossman, thank you for being here.
Thank you.
Thank you.